Doctor of Physical Therapy from Brooklyn, New York. Today I got my nice sister here. She had a car accident, but at the same time she worked in a hairdresser salon, and she came in for a knee pain. When I examined, I found that the legs are very edematous. Because she's slim, she's in good shape, it doesn't show there's edema, but when you press, you're gonna see there's pitting edema. See now, this is how to test for edema. I press and leave, still there. It was much worse than this. We did the raising of the legs in a ball. It's better now, but this was much better. It was pitting edema grade like 4 for her. This was like a couple of minutes ago, and it was much better. Okay, but was this much worse. Then what I do for this, she was saying, oh, it's okay for my job. She was thinking this is normal from her job. I told her, it's not okay. If you have a pitting edema and you press in your legs, and when you press, it stays there like a clay, it doesn't come out, it's called pitting edema. And the edema is two kinds, pitting and non-pitting. She had a pitting edema. When you press and you leave your hand, there'll be a mark. And how deep the mark is will be graded from grade 4 to grade 1. The worst is 4. If it goes too deep and stays. She was saying it's okay for my job because I work in a salon. I said, no, it's not okay. If you don't treat this, guys, what will happen? If we never treat this, there will be fluids in here. Those fluids has fibrin, and has a protein and has fibrin, and can cause adhesions. Fibrins will cause adhesions, and this will stay there, will not go, and could be disabling. Going to cause a lot of pain, difficult to move, and could be disabling. And even painkiller will not help. Non-inflammatory NSAIDs, the medications for non-steroidal anti-inflammatory, the non-steroidal anti-inflammatory medications will not help in late cases. And the only solution is to desensitize. We need to mobilize those fluids. We need to mobilize the tissues. We need to mobilize the fluids, milk it up, the same I do now here. And when you milk the fluids and mobilize it, fluids will disappear and pain will disappear. This for here. And I give her advices to use at the job. Because guys, we don't have one pump. People think we have only one pump for the circulatory system, which is the heart. The heart pump the blood, go down to the legs with the gravity. What brings the blood back up to the heart? Two other pumps. Number one is the breathing pump. I told her every half hour when you're working, you should do this. You come up, take a deep breath. When you take a deep breath, your chest size gets bigger. It creates negative intrathoracic pressure, works like a vacuum, and like a syringe. So pull the blood, the venous blood from the legs back to the heart. So help the heart bring the venous return back. That's number one. So deep breathing. The second pump, the second peripheral pump. Now we have 3 pumps. Central one is the heart. Second is the breathing, negative pump. And the other pump, which is positive pump, is the muscles. You come up in tippy toes 5 times. Get in a habit while you're working. Come in tippy toes. This will pump the venous blood back to the heart, because the vein travels through the muscle, and when the muscle contracts, when you step in tippy toes like this, the muscle will contract, squeeze the veins, send the blood back to the heart. This minimizes the edema. If we ignore this, guys, this can cause later on in life, God forbid, DVT, which is called deep venous thrombosis, called a thrombus or a clot. There's thrombus and a clot in the leg because leg veins are big. It's okay, but if you travel in the veins and go to the circulatory system, go in a small artery in the heart, can cause a heart attack, block the blood, go in some area of the heart, cause myocardial infarction, heart attack, can go in the brain, a small artery, can cause also stroke. I'm not scaring you guys, but it's better to know. Knowledge is a weapon. It's better to be safe, to prevent, better than to treat. Be safe than to be sorry. So this is pre-DVT. It's the same way, guys, to do when you have like a juice. The blood has cells and has plasma. Same when you make a juice, it has like the water and has the juice itself. Yes. If you leave the cup for a little bit, the water come up and the juice and the fruits come in a barm. So this is causes like precipitates. This precipitates may affect the veins, and we spoke about that in the previous video. If you squeeze here, if it hurts, could be, it's called positive Hoffman sign. If this hurts, could be a sign of to either one of three. Either diabetes or pre-diabetes, you have to be careful, so go check your blood sugar. If you have tenderness in the calf, could be diabetic, could be pre-diabetic. Hemoglobin A1C could be a little high. When hemoglobin A1C go higher, increases inflammation and causes pains in the body as well. So better to check, to get tested for hemoglobin A1C, which is the accumulative sugar in your blood for 3 months. Then after that could be the pre-DVT, and we spoke about that during burger exercise, and we spoke about burger exercise in a previous video. Check the previous video, guys, and we're gonna talk later. Best information around, and share it with the friends. So many people need the information. I'm gonna talk about another video. Bye.